All right, everybody. So we're going to be covering your MDI, DPI, and your uh, nebulizer. There's the word. Yep. Okay. And so if you'll print out your instructions, if you see me, I'm looking over here. There's a TV. I'm looking at it. So we'll just follow right along. So get yours printed out. Look at it while we go through this. Okay. So number 1 and 2, y'all know. Check the orders. Check the chart. All that jazz. Y'all know how to do that. Okay. Number 3, it says obtain your required equipment. Okay, so when you guys do this check off, we're gonna have it all out like this, right? You're gonna have to know what to grab, okay? And so Marcus is gonna maybe tell you to use this nebulizer, or maybe the other one with like the little basket like we talked about, or maybe this one that's like kind of like a little circular cup. Whatever the case may be, you're gonna have to know what piece to grab, okay? So the baffle is gonna be taken out. We're gonna put it all apart. You're gonna have to know how to put it together, okay? So it says oxygen flow meter. Obviously, I'm running this through air. Not all hospitals have medically produced air, right? And so like if you work at the med center, we use air, we run our treatments through air, but some hospitals do not. They run it through oxygen. But in this case, we want you guys to run it through air. So yes, you will have to grab a flow meter. Your nipple adapter, of course, goes to the bottom of your flow meter. Small volume nebulizer, okay? So that's any one of these little nebulizers that we've talked about, right? And then your medication or saline. And in this case, we've got a little saline bullet. We're going to use that. That's going to be your medication, okay? Just a little squirt in there, right? So then wash hands, put on gloves, pretend I have gloves on. Identify the patient, introduce self. You guys know how to do that. Explain the purpose. Don't just say I'm coming in here and give you some medicine, right? Because nurses give medicine, doctors give medicine. I'm from respiratory therapy. I'm here to give you a breathing treatment and give you your DPI, your dry powder inhaler, right? That sort of thing, or your MDI, your metered dose inhaler, right? Whatever you're giving them, explain that, okay? Determines most appropriate interface for your patient. So obviously with this guy, he can't hold it. He has no arms. So most appropriate for him is going to be a mask, right? So make sure I have a mask. But yeah, just whatever's most appropriate, you know, if your patient, and we really don't care, use a mouthpiece, use a mask, just know how to put it together, okay? Because this is on dummy, who cares, right? And so then it says positions patient in the upright position, right? So if his bed, we'll just pretend real quick, if his bed was laying down, right, I'm going to lay him down. So if he's laying down, I want to sit him up and make sure he's upright, he's ready to do his treatment, right? He's upright, he's ready to do his treatment. I can't have him laying down to take his treatment, okay? And so then it tells you to obtain your baseline vitals. You guys know that, heart rate, respiratory rate, his SpO2, all those things are baseline, right? Maybe even throw in blood pressure if you feel like it, right? All these things that we can get real quick and easy and assess before we give a treatment. Why do we want to know their heart rate? Right, if we give albuterol, right, you guys know that that will increase your heart rate, sort of stuff like that, right? And so if their heart rate's already like 120, I maybe need to call the doc and make sure that they want to give that treatment. Maybe it's going to elevate their heart rate to a dangerous level, right? So you want to make sure of certain things for your patient, right? So baseline vitals, heart rate, respiratory rate, SpO2, it also says breath sounds. So yes, in this instance, maybe if you feel comfortable, bring a stethoscope to help you remember, but just for my instance, I know I got to give breath sounds, so I'm going to say I will listen to the breath sounds, right? Okay, and then prepares medication in accordance to the physician's order. So maybe it's 2.5 milligrams, maybe it's, you know, whatever the case may be, we want to just make sure we're giving that right medication, right? This is where it's important of verifying your patient. In the hospital, this would have a label. You're going to scan the armband, you're going to scan your label, and you want to make sure this medication lines up for that patient, okay? Use aseptic technique. This is something huge that we have to learn, okay? So for your guys, it's like heated high flow stuff, and me and Lindsay talked about it, right? When you guys were setting it up, a cord would drop or something would hit the floor and you just keep going. It was fine then, right? But in real life, you want to be as clean or aseptic as possible, right? You don't want to touch things and get germs, right? Because hospitals have germs. And so when it says use aseptic technique, that's just being as clean as possible, right? If I'm squirting medication in here and I'm putting this together, obviously I would have on gloves, right? But I don't want to touch here, and I don't want to like fondle their mouthpiece, right? That's not really aseptic. I don't want to stick my finger down in the inside. All that's getting germs and just spreading things, right? You want to be aseptic, as clean and as best as possible, okay? So you would pick up your medication, be careful with how you do it, all that sort of thing, right? Use appropriate gas for propellant. In this case, we're using air, okay? But some hospitals, you can use oxygen, right? So instruct patient to take slow, deep breaths, with occasional inspiratory pause, right? We talked about this. This is a huge thing in your checkoff. You want to make sure that your patient is doing this correctly, breathing correctly, doing everything, right? And so if they're not following orders, you've got to instruct that patient how to do that properly. So I know we're doing this on a dummy, but maybe Marcus or me or Lindsay will say, well, your patient's not really doing it right. Can you re-instruct them, right? We're going to kind of throw that at you because sometimes your patients are not going to do what they're supposed to, and you got to know how to do that, right? So it says coaches and encourages patient. So as this treatment's on him, I'm just going to throw him a little mask right now. But let's just say I've got this mask on him, right? Maybe his treatment's going. I want to just make sure, hey, you're doing a good job. Maybe throughout the procedure, I'm monitoring those vitals. I'm making sure he's okay, right? That's what that means by encourages and coaches the patient, right? Ends therapy when the nebulizer begins to sputter, and it says shakes out and rinses. So all this is in accordance with your nebulizer, okay? So if I'm starting with my nebulizer checkoff, no matter which piece you use, I'll show you guys with this one. I'm gonna drop a little bit in there. See, I didn't even do a whole lot, just like a little bit, enough that you can see it in there, okay? And put your baffle and everything inside. Put your mouthpiece on. Again, you're not really like fondling this or anything. Like, you want to make sure it's not touching the floor. It's not touching certain parts to get it dirty, as clean as possible, right? And so this goes on. Hook it up to your air, right? And go and plug it in. Yes, we want you guys to plug it in. We want you set up. We want you to turn it on, right? And so here's my treatment. It's running, and I'm gonna just kind of help him out a little bit. Perfect, right? It's running, it's going. And so I'm coaching him, I'm telling him good job, I'm instructing him to take nice deep slow breaths, right? Occasional inspiratory pause. So I just kind of say, take a nice deep breath, and every now and then just kind of take a pause, right? And so my therapy's going, it's running, and then here in a little bit, when it starts to get kind of empty, wait a minute, right? So it's nebulizing, it's going, we're gonna run this treatment. It says ends therapy when the nebulizer begins to sputter. And so you're gonna hear, I'll show you what that sounds like a little bit. Right, so now if you can kind of hear that, it's not really coming out, it's starting to spit and sputter. I know my treatment's done, right? So I can end my therapy, right? It is now done. And now it says shakes out nebulizer. So I would go over to the sink, and we're not gonna do it because the sink's behind us. We're gonna have to turn the camera, all that mess, right? But we do want you to take your nebulizer, take it to the sink, dump it out, okay? You will dump out your nebulizer, and then you're gonna take sterile water, right? Not sink water because it has germs. We're gonna take sterile water, squirt it in, rinse it, dump it out, and then it says leave it out to dry. So what that looks like, I'm gonna take it apart, right? I'm gonna set my piece here, I'm gonna take my mouthpiece, and I'm gonna set my nebulizer upside down. Notice I've gathered some paper towels, right? We'll have them there for your checkoff. We'll grab you some, whatever, right? But set it upside down so it can dry out, right? That way it don't harvest germs. And I know you're gonna say, oh, well, what about the other nebulizers? It's all the same. This lid, you lay it down, take out your baffle on the inside, right? That one, same with this one, baffle comes out, and the lid and everything goes upside down. You're drying out. It's pretty easy, right? Okay, so all my pieces are there, they're clean, they're drying out. I was clean, I was aseptic, all that jazz, okay? That's basically your MDI, that's it. Your nebulizer, right? So now we're moving on to your MDI and also your DPI. I know it only says MDI, but we're also gonna make you do DPI as well. They're one and the same, you guys know how to do them, okay? So shake your MDI, that's this one. You're gonna shake that medication up, right? Shake it up, and you plug it into the dispenser, it just fits in like that. Notice, like, if you forget which way it turns, you can't put it in like this, right? See, this front part that has your instructions and what medication it goes on the front of that faces the patient. I don't know, maybe that'll help you remember that. Right, so you shake it, tell your patient, right? Again, this is big with coaching. So I'm gonna tell him to take a normal exhale, like let all of his air out, blow it out. Then when he starts to take that breath in, it's my job to squeeze it and coach him that when he takes that big deep breath in, big deep breath, and then I'm going to tell him hold your breath for at least 10 seconds or as long as you can, okay? So if you're reading your steps, shake your MDI, exhale normally, tell your patient to exhale. With mouth open fully, begin a slow inspiration while at the same time actuating the MDI. So I know it says with mouth fully open, but and so that's talking about where Marcus told you the 2 finger spaces right away. Their mouth's going to be open, and we let our air out, and then as we begin to breathe in, we would squeeze it, right? There it goes, okay? And inhale with an inspiratory pause. Tell your patient, hold their breath for 10 seconds or as long as you can, right? Some people can't hold their breath for 10 seconds. We're not gonna like kill them for not doing so, okay? Exhale normally and wait 1 minute before next actuation, right? So you wanna give this twice. For your checkoff, just tell us that you want them to wait 1 minute before the next is given, right? You don't want to give it back to back in like 10-second intervals. You want to wait 1 whole minute. Yes. And then again, this is where we get into it being the appropriate device for your patient. Maybe you couldn't coach them. Maybe it's a little kid and you tried to get them on their exhale and inhale and it just didn't work. That's where you get into a spacer, okay? Spacer plugs in on the end, right? You put your MDI on the end. Spacer fits over the mouth. It's pretty self-explanatory. I mean, it's curved right there for your nose. Goes like this, not like this, right? Okay. So this fits on top. You would hold it. I then don't have to worry about coaching my patient because maybe this is a kid that's fighting me. They're going to be all over the bed like this, right? I'm just going to do my best to hold this mask. I'm going to squeeze it, and as he's huffing and puffing, he's going to get the medication while it's sitting in the chamber. Okay. That's how you use your spacer, right? And then, like we talked about, that's a pediatric one. It's got like little teddy bears. It's all cute, whatever, right? This one's an adult one. It's the same thing. This one just collapses, so you pull it out and twist it into place, right? And then now he would put his lips around it, right? He would seal his lips, right? And yes, too, if you were wondering, I do believe this comes off. Maybe, I don't know. Maybe that was the other one. I don't know. Yes, this one comes off. Yeah, see, so we might pull it apart and make it put it together, right? It's not that scary. It just twists into place, okay? All three, the same thing. MDI goes in the fat end, mask or mouthpiece to your patient, okay? So encourages and assists the patient to cough. So after you've given this treatment, after you've given the MDI, so can you give me a good cough? He would cough, right? And yeah, so then we get into the next part of our checkoff. It says to recheck the vitals. So you're gonna state all of this again. Right, you're going to recheck his pulse, his rate, SpO2, his breath sounds. Notice it said if a steroid is given, instruct or assist the patient to rinse their mouth out. So a lot of times in the hospital, we'll have like a little cup of water. We'll give it to our patient, tell them to rinse their mouth out, and you'll catch their spit. You'll go dump it for them, okay? So in this case, obviously we're dealing with a dummy. Just instruct us that if you gave your patient a steroid, you know you would make them wash their mouth out, okay? Dispose of trash, leaves the patient area safe and clean, right? Chart everything you did, talk to I think it says like notify important personnel, all that kind of jazz, right? Talk to the doctor if need, discard PPE, chart, okay? Now notice when you get down to this charting part, it's a little bit different. You can't just say, chart all my things, right? We want you to specify everything listed. So if you're looking at your paper, go down, it says like 23, right? Charts therapy appropriately. I want you to tell me, Marcus and Lindsay, we want you to say, I'm going to chart the date and the time in my signature. I'm going to chart the medication and the dosage, pre and post vitals, pre and post breath sounds. I'm going to describe the cough and sputum, right? So you can tell us how was their cough. Was it weak? Was it strong? Was it productive? Non-productive? Right? All those sort of things. What did their sputum look like? You chart that. That's important. And then goals of therapy, right? You're going to have to list A through F right there on your paper. We want you to memorize and list those, okay? Memorize and list those. And then it says if adverse actions occur, stop your treatment immediately and notify appropriate personnel. So maybe in the middle of giving your treatment, right, you were doing your nebulizer and all of a sudden your patient's heart rate went from 80 to about 120. You're going to stop that treatment, right? You're not just going to keep going and wait for it to end. You're going to stop your treatment, right? Because I think the standard rule, correct me if I'm wrong, Marcus, but your heart rate, if it goes above 20 beats above, right? So if you're at 80 and it goes to 100, it's indicated to stop your treatment. If you're at 100 and it goes to 120, you need to stop your treatment, right? So if you have these adverse reactions, you would stop and then you would notify your personnel. You call the doctor, hey, this medication's not working. Do we have something that's not going to affect their heart rate? Maybe you're giving albuterol and you need to now give levoalbuterol, right? Okay. Is there anything else on that sheet? Sit down at the bottom. Oh, that's it. That's your lab. All right, and then I know I skipped over, but this is your DPI. You guys know we talked about this in class. If you're giving this to your patient, you click it open, right? Your little tab here is going to be at the top. You're going to pull it down. That loads it. And if you hear it, it clicks, right? So I'll right? It clicks. You put this to your patient's mouth, tell them nice, big, deep, quick breath, right? To suck the powder into their mouth, right? And then depending on, again, if this was a corticosteroid, have them rinse their mouth out, okay? That's all.
Yeah.